Welcome to On The Beat, everyone. I'm over here with Dr. Childrey, and we're talking all about new technology in skin tightening. There are so many new gadgets out there, correct, Dr. Childrey?
That's correct.
And men and women get so confused with what is available, what is the best type that one should have, what areas that we should be doing this on. What have you decided to bring into the clinic?
Well, we've decided to bring in a processor called Renuvion, and that involves J-plasma energy that we use after liposuction, or occasionally we can use it without liposuction to tighten skin, increasing the collagen shrinkage and the elastin production that's in the skin, so that we don't get the wrinkling and we don't get the sagging that we used to get.
Okay, so let's just talk a little bit about how it works. We're going to bring up a video of how that actually looks in an animation, of course. Explain that to everyone.
Well, most of the time we use it after liposuction, when you remove the fat and you still got the collagen bands and the elastin bands there, and the J-plasma energy is very selective for the collagen. And as the video will probably show you, when the energy selects out and attaches to the collagen, it causes a shrinking effect to bring the skin down closer to the fascial layer, and then you get skin tightening after it heals.
Okay, now, one thing, and look, I'm going to ask for my benefit as well. Is it something that men can use as well?
Men or women can use this technology, yes. Okay,
but we want everyone to also know it's not in replacement of liposuction, correct?
That's correct. If we have a patient that needs liposuction, you do the liposuction.
Right.
It is in addition to it. Because with liposuction, we've seen some skin tightening from the heat produced by laser or other technologies, but this augments that significantly. And if someone has just wrinkling, like above their knees, they have what they call the ugly knee, the skin's kind of drooping, they don't have a lot of fat there, you still can use the Renuvion to help tighten that skin without removing the fat, so you don't create a defect.
Okay, so let's talk a little bit about the areas of the body that this can be used on. You just said above the knee, correct?
Correct.
Now, are we talking about the face, the stomach, the sides?
Oh, we're going to use it in our clinic from the chin down.
Really?
Yes.
Okay. Now, what are we talking about downtime?
Downtime is the same amount of time that you'd have from the procedure, whether it's liposuction or no liposuction. It doesn't add to your downtime at all.
Okay. I think it's super important because people feel once one gets to a certain age that these systems no longer work. Correct?
Well,
is that true?
It's not totally true, but as we all age, we lose our collagen, we lose some elastin. So as long as you've got collagen present in the body at certain amounts, you will maintain the skin tightening.
Explain to everyone what the collagen part of their body is.
Collagen part are the bands of tissue that give us our tightness in our skin. And elastin allows us to be able to stretch the skin, and then it springs back.
Okay.
So we can lose both of those as we do get older.
Don't you just hate age sometimes?
It's a tough one.
Comes with wisdom, but everything else seems to sag, right?
That's true.
We hate that part. Okay, so let's talk a little bit about the process, okay? You would come in and have the all-important consultation. So even though we're talking about age, you would really be looking at the skin, not necessarily the age, right?
That's true. If you look at averages, most of us around 55 to 60 start losing our collagen. That's why our face and the rest of our body seems to become a little more sagging. But there are some people that even when they reach 70, their skin is still in very good shape, and we call it having good turgor. But there are other people at age 50, been in the sun a lot, or just genetically their skin is just not very elastic, and it doesn't have good collagen, then they're not going to have as good a result as someone else might.
All right. Well, the most important thing is the consultation, give you a call, and you can go from there, right?
That's correct.
We appreciate you again. Wish you all the best. This is a great procedure. I've seen it done before. If you want to find out more information about Dr. Childrey from Health Editions, there it all is, everyone. We've been talking all about the latest technology in skin tightening. Give them a buzz. We'll be back after this short break.